We're in the middle of National Nurses Week, and after a traumatic year for our healthcare heroes, two ladies we spoke with say it's been an honor to help people in their darkest times.
It's been so fulfilling to be able to be with these people during the scariest moments of their whole lives.
UW critical care nurse Laura Caston worked with patients on the COVID floor and says it's been an extremely difficult year.
And a full third of our patients died, and it was just continuously heartbreaking. I genuinely thought that it was a matter of not if I was going to get COVID and bring it to my family, but when.
And she wasn't the only one struggling.
It takes a big toll, a big cumulative toll.
UW registered nurse Mariah Clark, with tears in her eyes, remembers being there with the patients.
The last thing they feel may be the squeeze of a human hand, but it's the squeeze of a human hand in a glove.
The added stress in an already stressful job sent some seeking outside help to cope.
I have to say that a large number of my coworkers in the COVID ICU have unfortunately needed to be started on anti-anxiety or antidepressant medications.
A study out of England published in the journal Occupation Health found half of healthcare workers in the intensive care units during June and July of last year reported symptoms of post-traumatic stress disorder, 11% experiencing severe anxiety, and 6% experiencing severe depression.
So many of us have entered therapy to try and talk about the amount of death we've seen.
And even then, they are grateful to be there with the patients in good and bad times. Uba Ali, TMJ4 News.
Definitely the more we can do to support and lift up our nurses, the better after this historic year and a half. According to the International Council of Nurses, 51% of American nurses feel overwhelmed. 93% of all healthcare workers are stressed, and 76% report feeling exhaustion and burnout.